As members of the largest health profession with the most direct patient contact, nurses have suffered severe hardships from the COVID-19 pandemic. The AMN Healthcare 2021 Survey of Registered Nurses, Extreme Challenges, Extraordinary Impact, surveyed more than 6,500 registered nurses across the United States. The survey examined recent trends in the profession and in the lives of nurses. A major focus of the survey was the impact of COVID-19 on the mental health and well-being of these essential caregivers. So great were their challenges, we have recently published a special report on this singular topic and included strategies to better support and care for our nurses. The pandemic touched every corner of the nation. 83% of respondents said they had cared for patients with COVID-19, while 18% were themselves diagnosed with COVID-19. With 4 million nurses across the country, it is likely that as many as 720,000 nurses contracted the virus. Nurses who cared for patients with COVID-19 were significantly affected by their experiences, impacting their burden of stress and the effect on their personal and professional lives. The emotional impact of the pandemic on nurses has been an incredibly significant burden. 62% shared that they were emotionally drained, 57% said they feel burned out most days, and 51% were worried that their job caring for all of us is affecting their health. Not surprisingly, their concerns about working in nursing and their attitudes toward their profession and their workplaces was also greatly affected, with 39% who often feel like quitting. For nurses who contracted COVID-19, things were worse. They were more likely to experience negative health and wellness impacts from their work and to worry about the risks associated with their profession. Nearly twice as many nurses diagnosed with COVID-19 say they may leave the profession compared to nurses who are not diagnosed with COVID-19. Enhanced support for nurses could relieve the growing burden of stress caused by the pandemic. In fact, nearly 2/3 of nurses said that their healthcare organizations support a culture of wellness. And at organizations that provide programs for mental health support, 3/4 of nurses said those programs were moderately to very effective. And many nurses are taking self-care steps to address their mental health, with nearly half saying they engage in activities or access resources to address their mental health and well-being at least twice a week. However, 1/3 of nurses shared that they are not taking these steps to care for themselves. The pandemic's impact on healthcare requires extraordinary efforts by organizations and the public to support the overburdened mind, body, and spirit of nurses. Moral distress has become a daily challenge for many nurses who had to watch their patients suffer and sometimes die because resources were overwhelmed. Supporting the mental health and well-being of nurses needs to become a priority for all healthcare organizations and nurses themselves, as well as for federal, state, and local government agencies. Nurses heroically rose to meet the pandemic's onslaught with professionalism and at great risk to their personal health and the safety of their families. They have saved lives and reduced the suffering of thousands upon thousands of people throughout the pandemic. Their dedication and commitment to their patients and to the health of America and the world have been extraordinary. Nurses are not only integral to the healthcare industry, but to the health and well-being of everyone. That's why solutions to the challenges they face are everyone's responsibility. AMN Healthcare assisted with tens of thousands of nurse assignments during the pandemic. To provide them with the support they needed, we leveraged mobile technology to help them manage all business aspects of their work. We also adapted and expanded our support service to telehealth, especially mental health counseling. Our Employee Assistance Program offered programs such as free financial resources and legal support, to name a few, to help reduce the common stressors of healthcare professionals in a time of crisis. On March 18, 2022, President Biden signed into law the Dr. Lorna Breen Healthcare Provider Protection Act. The new law is intended to support healthcare workers' mental health and provides funding of up to $135 million in mental health education and awareness initiatives. These services help to reduce stigma, provide suicide prevention training, and encourage healthcare professionals to seek care. Nurses need our support. They are critical to the health of individuals and the overall health of our communities. A shared effort throughout our country can return the care to caregivers that they generously give to us. AMN Healthcare, empowering the future of care.